So what about interventions in normal childbirth? Are they normal? Are they okay? The World Health Organization says that in normal birth, there should be no valid reason to interfere with the natural process. So what that means is that as long as everything is proceeding as normal and not requiring any major intervention, that we shouldn't interfere. We shouldn't mess with the natural process. We should allow things to go as they normally would. But there are some interventions that can still be considered a part of the normal birth process. The first one is the augmentation of labor. Induction of labor means that you cause labor to begin when it wasn't happening before, usually with the use of Pitocin or some other kind of chemical agent. Augmentation of labor means that labor has already started on its own and you're introducing something to increase contractions, stimulate contractions to be stronger or more intense. So labor may be stalled and slowing down a little bit, or we might notice that labor is progressing in several other areas, but in one area it's not progressing very much, and you may need something to kick things into gear just a little bit more. That doesn't necessarily mean medications to stimulate labor. It may be some kind of natural means like movement, position changes, nipple stimulation, or something like that. Number 2 is listening to the baby's heart rate. Part of normal labor is monitoring the mother and baby and just making sure that all vital signs are good. So mother's blood pressure might be monitored, her temperature, her heart rate, the baby's heart rate, and making sure that mother and baby are both healthy. Because remember, part of normal labor is that mother and baby both need to be low risk and remain that way throughout the process. Number 3 is the artificial rupture of membranes. So this is when your caregiver manually breaks your water or breaks your bag of water. Some doctors and midwives say that this helps to progress labor by removing the water and removing the cushion so the baby's head can be applied to the cervix and cause it to open and dilate. In other cases, midwives and doctors like to break the bag of waters before the baby is born because they want to help make sure that the baby doesn't aspirate any of the fluid in. In cases where there might be a risk of cord prolapse, they may want to remove the bag of water so there isn't a big gush of fluid where the cord would prolapse and cause a major complication. There may be some other reasons, and you would need to ask your caregiver why they would want to artificially rupture your membranes. Number 4, reducing labor pain. This is definitely a part of normal birth. Now, there are natural ways of reducing labor pain, and that includes things like walking, changing position, having a good support team like your labor partner, your caregiver, your birth doula. And it can also include medical pain relief like narcotics or an epidural. But managing your pain or reducing your pain during labor with relaxation techniques, hypnosis, and other means is part of the normal birth process. And number 5 is active management of the third stage of labor. Active management in the third stage of labor refers to the introduction of Pitocin in order to help the uterus contract and expel the placenta, and it can also help to reduce bleeding. So in the case especially that you have any kind of excess bleeding or postpartum hemorrhage, Pitocin helps to reduce and stop that. If it doesn't look like you're having any problems with bleeding, your caregiver may not give you any Pitocin, or you may request not to have Pitocin.